Breast augmentation actually began with implants in Houston, Texas in 1963, two doctors, Cronin and Giroux. So now, fast forward 50-something years, the implant technology's improved. The FDA looked, this is a silicone implant, and they looked at them for 13 years for use in aesthetic enhancement of the breast, and they found no contraindications. They're safe. The other implant is a saline implant. It's an implant that is the same shell as this one, except it's filled with salt water. This is filled with silicone gel. The choice between the two depends on the patient, depends on their, I don't really tell the patient one way or another. I make suggestions to them based on how thin they are, their age, their wishes. But a lot of times patients come to me and they already have an idea of what implant they want. They're from their friends, their neighbors, the internet, the prevailing ideas about implants. So now the walls are thicker. The gel in the implant now is more cohesive, we call it. So if it were to break, it's easier to get out. So from that standpoint, what's improved as well is a long time ago, we put them in and the body overreacted to the implant because they leaked this gel through the wall of the implant. Now the shell of the implant is much more durable, and that doesn't happen like it used to. So the ability for the body to accept the implant is better. So from a medical standpoint, they're safe. Could they break? Yes. Is the chance of them breaking very high? No. But we still have patients monitored. We do all the common sense things. But they have been looked at extremely closely and were put back on the market for general use by the FDA in 2006.
The saline implants, are there negative implications with that source as well?
That's a very good question. So when you use salt water inside a hard shell envelope, it can wrinkle more. When the patient's sitting up, there's a higher chance that they could feel or see rippling of the implant. And so that's the reason that most patients like silicone over saline.
And finally, talk to me a little bit about the difference in cost between the two.
The actual implant cost for silicone has come down significantly. When at the height of the problems with silicone, the implants were almost twice as much as they are now. So saline implants, a pair cost, from my office, $500. A pair of silicone implants is about $1,000. But the properties between the two, most people like the silicone better. And that's basically a personal choice that the patient makes. I show them all the implant choices and I let them look and see what they like.
And what is the downtime now for these kinds of procedures?
I do the surgery in my office, so it's done with an anesthesiologist. The patient can either be awake and sedated or they can be completely asleep. Some people just don't want to know, they want to be asleep. Doesn't matter to me. So they're going to be sore for several days. I encourage them to get up and get around, start activity, to do things as quickly as they can from the standpoint of activities of daily living so that their soreness gets better.
Probably one of the little known procedures now, little known meaning that I don't think it's as known as the breast augmentation, is the breast reductions that you're doing now. Talk about that and how big a part of your business is that. Reduction is very prominent. The number of people who have breast reduction is much more than you would think. There are lots of women who suffer, and I mean suffer, because their breasts are too big for their frame. It causes neck, back, and shoulder pain, and there's no garment they can wear. When they wear a bra, it just transfers the pain to their neck and their shoulders. And that chronically goes on for years. Some of the happiest patients I have are the people who've had breast reductions because it takes that weight off of their neck and shoulders. It's like a porch that doesn't have enough support, and the breasts hang down and cause the problems with their neck and shoulders to hurt no matter what they do. Talk to me then about what this does for the patient beyond the changes physically. Sure, Tony. The changes that happen beyond the physical appearance, the patient radiates more. Their confidence, they feel better about themselves in a way that's really emotional, not physical. It transcends anything that may just be their breasts are bigger. They feel better about themselves. Their clothes fit better. They look better. Their overall attitude is better. it truly is a life-changing experience.
Very positive, extremely positive. The patients that I do breast augmentation on are extremely happy with how they look and how they feel. And the feel part's just as important as how they look.